Hey everyone, today I'm diving into a critical global health crisis, antimicrobial resistance or AMR. This growing problem is shaking up modern medicine, making common infections harder and sometimes impossible to treat. Let's break down the reality of AMR, the organisms involved, and how we've arrived at this crisis. So what exactly is AMR? It's when bacteria, viruses, fungi or parasites evolve to withstand the medications designed to eliminate them. This resistance means longer illnesses, higher healthcare costs, and unfortunately, more deaths. In 2019, AMR was directly responsible for about 1.27 million deaths worldwide and played a role in nearly 4.95 million deaths. If we don't act quickly, these numbers will skyrocket, and minor infections could become deadly again. Now, let's talk about the culprits. Among the most concerning are the escape pathogens. Enterococcus faecium, Staphylococcus aureus, Klebsiella pneumoniae, Acinetobacter baumannii, Pseudomonas aeruginosa, and Enterobacter species. These bacteria are notorious for dodging even the last-line antibiotics. And then there's Carbapenem-resistant Klebsiella pneumonia, making even the strongest antibiotics useless. In some scenarios, we're facing untreatable bacterial infections with no effective antibiotics left. You might wonder, how did we get here? Misuse and overuse of antibiotics are major drivers. Antibiotics are often prescribed when they aren't needed, like for viral infections where they have no effect. Overprescription happens due to misdiagnosis, patient demand, or lack of rapid diagnostic tests. Sometimes, antibiotics are given empirically without identifying the pathogen, boosting the chances of resistance. On the flip side, underuse, when patients don't finish their antibiotics, lets bacteria survive and adapt, adding fuel to the fire. In hospitals, resistant infections like MRSA and VRE lead to longer stays and higher mortality rates. Drug-resistant tuberculosis, like MDR-TB and XDR-TB, has become a nightmare to treat in some regions. Outside healthcare, the agricultural industry's overuse of antibiotics in livestock is a big contributor. Resistant bacteria can jump from animals to humans through food and the environment. Combating AMR involves precise pathogen identification and selecting the right treatment. Medical scientists are crucial here, analyzing samples, performing MALDI-TOF mass spectrometry, and conducting susceptibility tests to figure out the effective medications. Their work ensures antibiotics are prescribed only when necessary and the right drugs are chosen. While improper prescribing is a big part of AMR, it's not the whole story. Recent reviews suggest that blaming physicians alone is inaccurate. Resistance is a complex issue, also driven by patient non-compliance, over-the-counter antibiotic access, poor sanitation and weak infection control. It takes a team effort, healthcare pros, researchers, policymakers and the public, to tackle AMR. Antimicrobial resistance is one of the biggest challenges of our time, threatening decades of medical progress. The solution? Responsible antibiotic use, investing in new treatments, and better diagnostics. Everyone has a role to play, from healthcare pros prescribing responsibly to individuals using antibiotics correctly. Stay informed and share this message to raise awareness about this urgent issue. Remember, this video is for educational purposes only. Always consult healthcare professionals for medical advice. Thanks for watching.